Rabies is a viral disease that's predominantly spread by contact with infected animals. Uh, can also be spread by contact with an infected human, but usually, I mean, people don't generally go around biting other people. We usually get it from bites or licks from infected animals. But the incidence of rabies in the United States is really very uncommon. It's a disease that's talked about much more often than seen. There are only about 2 or 3 cases a year in the United States that actually develop in the United States. There are a few we see from people who import it from other countries, who are either travelers acquired it in another country or else somebody who immigrated from that country and who has it. But worldwide, there are about 59,000 deaths a year from rabies, mostly in developing countries where they don't have access to health care and where they aren't able to vaccinate the animals. Like in this country, we seldom see rabies in dogs because our dogs are all vaccinated, whereas in other developing countries, they're not able to vaccinate the dogs. There are a lot of stray dogs, and canine rabies is the most common um, or spread of disease from canines is the most common mode of spread in developing countries, where in this country we get it mostly from wild animals. The virus is a rhabdovirus or a lysovirus. It's a virus that again is inoculated into the system either with a bite or some other form of direct contact with an infected animal, and gets into the area of the bite and then spreads through the nerves up until it reaches the central nervous system, the brain, where it can cause a tremendous disruption in function of the brain, and it's almost invariably fatal. It has the highest fatality rate, basically, of any infectious disease. It's almost, if you actually acquire a full-blown case of rabies, it's practically a certainty that it will be fatal. The interesting thing, the other side of that coin, is it's almost 100% preventable. If you come in contact with a rabid animal, it's almost 100% preventable. So the idea, obviously, with this disease is prevent it, don't wait to get it, because once you have symptoms, it's far less likely that you're going to recover.